This is Virginia Dyes, co-director of the National Aging and Disability Transportation Center. I'd like to welcome Nora Super as a presenter for our course on caregiving and transportation. Nora leads N4A's, the National Association of Area Agencies on Aging, training, technical assistance, research, and development efforts. She is Chief of Programs and Services at N4A and oversees a number of key programs, including the NADTC, as well as the Dementia Friendly America initiative. Prior to joining N4A in 2016, Nora served as the Executive Director of the 2015 White House Conference on Aging, where she was responsible for directing a nationwide effort to identify and advance actions to improve the quality of life of older Americans. Prior to that, she served as Director of Public Affairs at the U.S. Department of Health and Human Services Office of the National Coordinator for Health Information Technology, and before joining the Federal Service, she also worked at AARP as Director of Federal Government Relations in Health and Long-Term Care. She has more than 20 years of experience working in Washington, D.C. on a wide range of aging policy issues, including healthcare delivery and payment reform. And her master's degree in public administration with a concentration in health policy was awarded from George Washington University. So with that, I'd like to welcome Nora, who's going to be talking with us about Dementia Friendly America and Dementia Friends. Nora?
Great. Thank you, Virginia. I'm so excited to be here to talk about Dementia Friendly America and Dementia Friends. It's a great new program that recently launched and is part of our ongoing effort to make all communities more age-friendly and dementia-friendly. I want to give you some brief background on Dementia Friendly America. Dementia Friendly America is based on the Act on Alzheimer's model in Minnesota, which has been working since 2011 to foster dementia-friendly communities and has been a trailblazer in dementia-friendly community work in the United States. Dementia Friendly America builds upon the Act on Alzheimer's model and offers tools to community nationwide to help them become more dementia-friendly. DFA, as we call it, was officially launched at the 2015 White House Conference on Aging with 8 pilot communities on board. The goal was to reach a total of 15 communities by the end of the first year. We found that communities were incredibly interested in this work, and the goal of 15 communities was exceeded quickly. We now have dozens of DFA communities across 38 states. As Virginia mentioned, since I served as the Executive Director of the White House Conference on Aging, I consider this to be one of my babies, and this baby has definitely launched. Our goal is to have DFA engagement in all 50 states by the end of 2017 or a few months later. So you may ask, what is Dementia Friendly America? The goal of the Dementia Friendly America initiative is to foster dementia-friendly communities across the country. We believe that a dementia-friendly community is informed, safe, and respectful of individuals with the disease, their families and caregivers, and provides supportive options that foster quality of life. We are delighted to have a collaboration that is led by a coalition of over 35 national organizations that you can see on the screen here. These organizations represent different aspects of community. These include, but aren't limited to, healthcare, philanthropy, residential care, community-based services, faith-based sectors, and more. Just as local communities must work through partnerships and across sectors to become more dementia-friendly, so do we at the national level. The next few slides lay out why we think demographically dementia-friendly communities are so important and how the Dementia Friendly America initiative can help communities achieve their dementia-friendly goals. First, as you know, the population is aging. With age being the greatest risk factor for dementia, the number of people with Alzheimer's disease is also growing. There are over 5 million people today living with this disease. By 2025, less than 10 years from now, there will be 7 million people living with the disease. But not only that, people with Alzheimer's disease or a related dementia reside in their communities, and nearly 60% stay in their own homes. 1 in 7, in fact, live alone. Let me say that again. 1 in 7 live alone. So we have particular challenges with many of people living with dementia that need to be addressed by our broader long-term services and support community. The increase in the numbers doesn't just affect individuals living with the disease, it also affects their family and friend care partners. 80% of all unpaid help comes from family members. This equates to a lot of help. In 2014, caregivers provided 18.2 billion hours of unpaid care, averaging 22 hours per week. It's estimated to be valued at $230 billion of care. Caregiving, for those of you who do it, is not an easy job, as you know. It can take physical, emotional, and spiritual toll on caregivers. In 2014, it was estimated that caregiving responsibilities led to nearly $11 billion in health care costs. But the impact of Alzheimer's disease and related dementia goes beyond the individual with the disease and their family, friends, and neighbors. Dementia also has a cost to U.S. society, including businesses. The cost of health and long-term care for people with dementia is substantial. Adding together insurance payments and individual out-of-pocket payments in 2017 equates to $259 billion. It's also estimated that businesses lose $34 billion annually in lost revenue or productivity due to caregiver responsibilities. As a result, we are seeing more and more DFA communities engage in collaboration with businesses, not just from the employee-caregiver angle, but also businesses that interact with consumers wanting to be more proficient at interacting and communicating with people with dementia. So, Dementia Friendly America, how do we address these issues? Dementia Friendly America is a locally driven model with national resources, tools, and support. Every part of the community plays a role and can work together to take steps to create a dementia-friendly culture. The cloud here represents the different sectors of community that are part of Dementia Friendly America. In a dementia-friendly community, businesses such as banks and financial and legal services support customers with dementia, and employers support employees who are caregivers. Healthcare systems promote early diagnosis and options for ongoing care and support. Communities of faith that provide welcoming and engaging environments for those with the disease and their caregivers. Local governments plan and implement housing, transportation, public spaces, and emergency response that enable people with dementia to thrive in the community. Neighbors and communities also have a part. They are understanding and supportive to those around them, including individuals with cognitive impairment. Residential care and community-based supports offer a range of services to maximize independence and support ongoing community engagement with a variety of options adapted to cognitive decline. When we say DFA is a multi-sector model, this is what we mean. The Dementia Friendly America initiative provides a system of technical assistance and tools and resources to assist communities and individuals in taking action to improve community and system capabilities, optimize the health, well-being, and involvement of people with dementia and their caregivers, and support them to continue in their roles. As I mentioned earlier, we've seen rapid growth in the number of communities that are engaging or actively planning their DFA work. We are now in 38 states. Our goal is to have engagement in all 50 states within the next few months, so we are very much focused on our outreach efforts while also continuing to provide support to DFA's existing communities. Again, when we ask, what is a dementia-friendly community? What it means to us is a dementia-friendly community is informed, safe, and respectful of individuals with the disease, their families and caregivers, and provides supportive options that foster a quality of life. This is a snapshot of a tool that we have on our website that we in DFA communities use as a guidepost for how we gauge progress on what it means to be dementia-friendly. DFA is a grassroots model. While each community will have its unique priority areas, these metrics are areas that many communities would want to consider, such as training sectors on signs of dementia, addressing environmental factors, clear signage, wayfinders, places for seatings, for example, implementing staff or workforce training on dementia or difficult situations. The Dementia Friendly America Initiative provides technical assistance, tools, and resources to assist communities and individuals in taking actions to become more dementia-friendly. Our goal at the national level is to help communities by laying out a roadmap that you can pick and choose pieces from. Our website includes sector guides, provider tools, a community toolkit, and other guidance for communities working towards becoming dementia-friendly. We also have a pre-recorded webinar on our website that walks you through the website in more detail. All resources on the DFA website are free, downloadable, and customizable. Some communities choose to do a full community toolkit approach. This 4-step toolkit guides the community process with enough structure to help groups come together and create a shared agenda, but it's flexible enough in that it allows communities to define their own goals and approach the work in a way that's most suitable for each unique community. There's no obligation to use the toolkit. It's simply available to those who find value in it. The toolkit walks communities through the main phases of engagement. Number 1, convening a group of stakeholders and forming an action team. Number 2, engaging key leaders in community to assess areas of strength and feature development. Number 3, analyzing those needs and determining priorities. And the 4th step is acting together. Other communities may choose instead to across multiple sectors. Not all communities undertake the full toolkit approach, so they can decide within their own communities which of the sectors make the most sense. For those of you involved in transportation, you can see that one sector approach is dedicated to government, community, and mobility planning. Of course, transportation issues are a big challenge for people living with dementia and their caregivers, and so we try to find ways to make their lives easier. Many states have dementia state plans that help to guide this work and have involved in-depth analysis and may have existing action committees or steering committees. As a result, many communities take a sector-based approach to DFA. On our website, you will find a wealth of information on each sector. The sector guides give communities a framework for engaging with sectors. What practices should someone in legal services consider, for example? What are specific resources related to legal services that a community should know about? Do any guidelines exist that should be used? Every part of the community has a unique role in meaningfully supporting people with dementia and their family and friend care partners. Sector guides provide information, resources, and actions that specific sectors can take. Most communities, whether doing a community toolkit approach or a sector guide approach or some combination of the two, will have an action team. Some communities engage all sectors of community, and that is great. Other communities start with a few sectors. We usually recommend starting with, at minimum, health system, public sector, and at least one other sector, and build from there. A critical factor for action team formation is the participation and engagement of people living with dementia and their families and care partners. We find this the people living with dementia and their caregivers to be invaluable resources for how we can make communities more dementia-friendly. The idea behind having various sectors represented on the action team, for example, it's easier for a lawyer to talk with a lawyer, same with the medical profession, or really in any profession. Transportation professionals can talk about solutions to make their transportation services more dementia-friendly. Finding the right partners for an action team is very important to consider. Dementia Friendly America is all about what will work in your community, given its assets and areas of development, so even though the core is always the same, each community's initiative will look a little different. Again, some communities implement the full four-stage toolkit. Some communities, aware of areas of greatest need, focus on sector-based training and adoption of dementia-friendly practices. In many cases, what we call community is a city, county, or township. In other cases, we are working with a state contact, and they are working with local communities on dementia friendliness. Now I just give you a couple of slides to show how the different sector-based training and adoption of dementia-friendly practices work. This one shows a regional state champion and sector-based training team that develop the practices for the sectors which each of them adopt. Other states are approaching local community activation and toolkit implementation. Under this approach, there's a centralized technical assistance mechanism for community, and then the local communities are asked to implement the toolkit. Now I'll just share with you a few sample community actions that we've seen spring up all over the country. Many are offering training to faith communities. In fact, we're developing some guides that will be available soon for those who want to offer dementia-friendly practices in their faith communities. Offering opportunities for people with dementia, such as arts, pottery, volunteer opportunities. Organizing memory cafes for people with memory loss and caregivers. This has been a very popular approach. In the state of Massachusetts, there are over 100 memory cafes. These are informal opportunities for people with dementia and their caregivers where they can come together socially. When people get diagnosed with dementia, they and their caregivers often find that they may become isolated from their social network. The memory cafes provide them an opportunity to actually expand their network and spend time with people that are under the same circumstances that they are. Others organize virtual dementia experience for health professionals and other professionals so that they can simulate what it's like to have dementia, so they can be more empathetic to what is happening with some people that are living with dementia. Other communities, such as one in Wyoming, are developing dementia-friendly business designations and decals. They're coming up with criteria for training their staff about how to be dementia-friendly. For example, in a restaurant, you can provide a more quiet room. You can train the servers to be more patient with individuals living with dementia so that they are allowed to take their time and choose what they want. Our goal is always to treat the people living with dementia with dignity and respect. We also have some communities that are providing dementia-friendly training to senior centers so that people that are living in the community can be more dementia-friendly towards those in their community. We've had many successful programs collaborating with law enforcement on training, ID bracelets, or a file of life initiatives. And as I mentioned, we're working with many local restaurants for dementia-friendly dinners. Some have even given one evening a week where they advertise that they'll be serving dementia-friendly dinners. Here's a few other actions that you can do, encouraging groups or individuals to become dementia friends. I'll talk more about that program in a minute. You can connect with healthcare partners about diagnosis and clinical trials. Sometimes people ask how this initiative aligns with the work they're doing in their communities on age-friendly work. The answer is these work very well together. Dementia Friendly America is a complement, not a conflict, to age-friendly work. We view age and dementia-friendly initiatives as a Venn diagram where the initiatives have lots of complementary work, but also unique areas of focus. You'll see on our website we have a tool that provides a comparative analysis of age-friendly and dementia-friendly communities. Dementia Friends USA was launched in January 2017, and DFA is the U.S. licensee of the UK Dementia Friends program. Whereas DFA works at the community level, Dementia Friends USA is all about individual impact. The idea is that any individual can have an impact in the community if they have some basic knowledge on dementia. Dementia Friends USA is part of the Dementia Friendly America umbrella. Here's a screenshot from our Dementia Friends USA website. You'll see that today we have nearly 7,000 people registered as Dementia Friends. Becoming a Dementia Friend is very easy. It just takes 10 minutes to walk through our website, and we have many resources available. Right now, I'd like to show you one of the overview videos that we have on our Dementia Friends USA website to give you a broader understanding of this initiative.
If you saw someone living with dementia, would you recognize the signs? Would you be uncomfortable? Would you avoid them? Would you be frustrated? Would you do nothing? Or would you be a friend? Would you engage them and empower them to get through their day? Would you welcome the opportunity to help them feel like a part of your community? Would you take even the smallest step to make their world less frightening or confusing? Every single one of us has a unique part to play in the lives of people living with dementia in our community. Become a Dementia Friend today and build communities where all people can live, age, and thrive.
Hey, Mr. Fredrickson, it's Tuesday. Aren't you going to the store?
Yeah.
Come on, I'll walk with you.
Find out more at dementiafriendsusa.org.
There are two main ways to become a Dementia Friend. You can go online to our website, look at the overview video that we just showed, or look at many of the sector-based approaches. We've just added 6 more in the past 2 months alone. So whatever your interest area, we hope there's a video for you to watch. They're very short. Most are only 2 minutes long, but they give you an overview of how you can become a Dementia Friend. We also have the opportunity to work with a master champion organization in each of the states through a sub-license agreement process to offer in-person Dementia Friend sessions. We now have agreements with 14 states. The master champion organization is responsible for training champions to deliver the in-person sessions, tracking data, and ensuring statewide reach. We hope you are excited as we are about Dementia Friendly America and want to become a part. You can sign up just by going onto our website to receive our newsletter of what's going on across the country and various Dementia Friendly America initiatives. You can follow us on social media. You see there the handles for both DFA America and Dementia Friends. And last, but certainly not least, you too can become a Dementia Friend. Often that's the first step to understanding what it takes to become a dementia-friendly community. We support DFA communities through a variety of website materials that are all free, downloadable, customizable. Just use them. We also provide technical assistance and support, regular learning collaboratives just for communities that are part of the DFA network, and encourage mutual support and learning between DFA communities. We also often facilitate or assist with kickoff workshops in communities. That's an overview of Dementia Friendly America. I hope that you've enjoyed it and are excited about it as we are. We look forward to working with you on making your communities more dementia friendly in the future.